Everything's gonna be alright. Everything's gonna be alright. And nobody's gotta worry about nothing. Don't go hitting that panic button. It ain't worth spilling your drink. Everything's gonna be alright.
Well, gentlemen, thank you for being here. I worry that if this would have been 150 years ago, this little conversation, four guys in masks, they would have accused us of just robbing the local bank.
I think you're right.
But in 2020, I think everybody understands. So we'll have a little conversation about the school reopening here in Duchesne County School District. Introductions. Principal Guyman is the principal at Centennial Elementary School in Roosevelt. Principal Forsythe is an assistant principal at Roosevelt Junior High School. I'm Jason Young. I work at the district office, and Philip Mertosh also in the district office. So different perspectives, and we'll try to address common questions that our public has, and these gentlemen will provide the answers as best we can up to date today. So our first question, we'll ask Mr. Mertosh here. What is the best way for people to get their specific questions, maybe unique to their circumstances? How do they get those questions answered?
We would strongly encourage those individuals to get with their building principals and sit down and discuss. The principals would be more than willing to sit down and talk with them. We understand that there are unique situations, circumstances. We know that there are health plans and things that we need to take into consideration. So please make an appointment with the principal. Come in, sit down with the principal, bring in your concerns, maybe even have them in a list so that you can address each one of those and make a plan for your students' needs.
Very good. Hopefully we've done a pretty good job of getting information out there already, so hopefully we answer many questions beforehand, but there will always be some, so
Yep.
that's great. Mr. Forsythe, we'll ask you the next one. It seems to be an issue on a lot of the minds of a lot of people are masks in school. So maybe I'll just ask, what kinds of masks will be allowed in our schools?
Sure. That's been a really hot topic. I know masks is kind of a big issue right now, and there's lots of different face coverings. So the word I like to use better than mask is face covering. And so there's lots of options out there for parents, teachers, staff that can find the face covering that they feel most comfortable with. And maybe their student needs to try different styles to see which style they're most comfortable with. The couple things they need to make sure that they don't violate district dress code policy. We'll treat masks the same way as we treat all the other dress code policies in our buildings. And then each student that rides the bus will also need to have a face covering as they enter the bus and while they're on their time at the bus. Masks will be required other than when we're eating lunch. They'll need to remove masks, of course, to eat lunch. And then there'll be some activities where they can maintain their 6 feet social distancing where they'll be able to remove those masks as well. So some of those activities, they'll be able to remove the mask. But we will need those masks worn at all times, and different styles will be okay of face coverings.
That's great. Thank you. Principal Guyman will use your elementary expertise here. A lot of questions about recess. Will we have recess, and if so, how will it work?
The short answer is yes. Kids definitely need recess, and each school has an individual plan for how recess will work and look at their school. We are going to be spreading out kids more, staggering recesses, maybe part of a grade or one grade at a time rather than two. We're planning extra cleaning, sanitizing of playground equipment between groups. And then most of us have plenty of space outside to really spread the kids out at different activities. Maybe some schools even have multiple playgrounds that will be able to socially distance the kids as best as possible while still allowing kids to have fun and have recess at school.
Very good.
I was going to add one thing to Scott's answer too, specific to elementary schools, especially on face coverings, is talking to all the elementary principals. I think all of us are planning on having face shields available for students that maybe, or families maybe can't afford those at times when a kid is working on reading skills with a teacher. that if a family can't provide those, then our schools will. So we can see their mouth and different things they're doing as they're learning to read. So,
Yeah, that's I'm glad you brought that up. I know in the early grades, being able to see the teacher's face
yeah.
is quite critical for those pronunciation of words and sounds. Mr. Forsyth, back to
Yes,
you
sir.
again. Speaking of the classroom now, so we're in the classroom.
Okay.
And how is that going to be set up and organized, and how will the classroom look in this
Sure,
time?
sure. We all know that classes are full of lots of kids. So 6 feet spacing may not be ideal. I've met with some teachers this past week and where 6 feet spacing will be possible. We may have to rearrange some things, but we know that our classrooms are full. So we're going to set up routing procedures. So kids will walk. We'll have arrows on the floor so kids know which way to walk to get to their assigned seating and get that way. We're also going to sanitize classrooms in between classes. Those kids that move and rotate classes at the junior high and high school will sanitize desks and classes in between. And we are going to try and space kids out as much as we can. I think keeping those kids spaced out at the elementary level, shared supplies. I know a lot of times, Mr. Guyman, the elementary kids have community crayons and community pens and pencils, and we're going to really try and limit those. I know art and things at the junior high, we're really going to try and limit those community things and make sure that kids have their own supplies and have their own things that way. And then, of course, assigned seating. So we're going to ask teachers that when those students come in and get a seat at the beginning of the school year, that they remain in that seat at least through the semester, and maybe a class change they'd have to change. But we want to know who those kids are, where those kids are sitting, and who they're sitting by, so that we can have easy access to those students if we need to, relay a message to them or get a hold of them that way. So, but we are going to space kids out as best as we can. We know that's a concern in our crowded classrooms. So we'll spread them out and keep them directing. Also, at the junior high and high school, we're going to have divided hallways with arrows directing students to walk up and down the hallways, trying to have some one-way hallways so that we can just keep those kids moving, in a similar direction up and down our hallways.
That's a good idea.
Yeah.
We're doing the best we can. That's what
Absolutely.
it sounds like to me.
Absolutely.
Very good. He kind of touched on this a little bit. Maybe if you could help us some more, Mr. Bertosh, on the classrooms, the cleaning and disinfecting. You mentioned a little bit, but what other process do we have across the district?
Well, we have several things in place. One is that we're going to have our custodian staff, but they're going to have an increased presence in cleaning those classrooms. We have some sanitation equipment that they're going to be using twice a week after school that we've received some great information on, great reviews that will come in and sanitize those rooms. But I'll speak to a secondary setting and speak to an elementary setting, but a secondary setting could be sanitization in between classes could be as simple as each student be given a Clorox wipe and they wipe down their area where they're at before they leave the room. Teachers at the same time, if there's a high use area, they can come in with a Clorox wipe or a sanitization fluid solution and be able to wipe down those areas. In the elementary classroom, you may not want the individual students wiping down, but we can have the teachers will be cleaning those high use areas all the time and making sure that we have our doorknobs cleaned continuously, handrails are being cleaned continuously, bathrooms updated, those types of things. I know that one of the things we want to do is minimize touch places as much as possible. So we're planning on propping doors open so that kids don't have to grab the door handles and we don't have a lot of touching happening there. So several things in place to try to make sure that we minimize risk anywhere we can and keep things as clean as possible.
Okay, very good. Thank you. I think we'll go on to lunchtime now here. Breakfast and lunchtime. Mr. Forsyth, if you'd help us out with that.
You bet.
So here it is. It's breakfast or lunchtime. How's that process going to look? And maybe we'll split that up. Maybe you could kind of speak to the secondary and Mr. Guyman kind of the elementary,
Okay.
how the food services part's going to work out.
Sure. So for secondary, for lunches, we're just going to offer more lunch periods. I think we're going to try and have fewer kids in the lunchroom at a time, and also try and maximize our lunch spaces. We're looking at other areas of the schools where we could allow those kids to go to eat their lunch rather than remain in the lunchroom. We'll sanitize lunches, lunch areas in between lunches. At the junior high, we're looking at having 4 lunches in the fall, just to limit the number of students in there at a time.
Whereas in the past, we've only had 2.
We've only had 2 lunches,
Now
right?
4, so fewer kids
So
will be in there.
half those kids out. We're also going to mark seats where we do not want students to seat. So instead of having 8 or 9 kids around the table, we'll have 4. And that'll allow some distancing there during lunch. In between lunches, we'll have our staff sanitize. Of course, all of our lunch staff and our custodial staff will wear masks at all times. And then, as I mentioned earlier, when we set up arrows, we'll also set up arrows of where we want those students to walk in the order to get their lunch and pick up their lunch. There won't be as many a la carte items available for lunch. Everything will have to be pre-packaged. Salads and those things will just be pre-made and available for kids. But I don't think kids are going to notice a lot of changes to their lunch, other than just fewer kids in there having lunch at a time and trying to allow for a little more distancing there. And maybe they'll get an opportunity to eat lunch outside one day or something that where we can spread out a little bit more.
Very good.
So.
And I'd say a couple questions that I've received specific, from some parents to maybe elementary schools and even specifically my setting, but I think we're all on about the same page, one is breakfast. Are we still going to provide breakfast? And yes, we are. And breakfast is pretty easy to socially distance. We'll, just like the secondary schools, we'll have seats where students can sit or they can't sit. So that'll spread kids out. We are asking that if a child does not need breakfast, if at all possible, the parents wait until about 8 o'clock to bring their children to school, because as we're going to cut back on that morning before school recess, and just send the kids directly to classrooms. And so if they can get there closer to 8, that helps with that. If they need to get breakfast, they'll have breakfast and then go straight to the classroom rather than out to recess. Similar things with lunch. We're going to be, all the elementary schools will be staggering our lunches more. So for example, at my school, typically 2 grades are in having lunch. This year we'll have 1 grade, and so they'll have twice the room so we can spread out students more. And that's pretty consistent across the district. Just as far as staggering those, and being able to spread the kids out more, and like you said, sanitizing hands before and after, and having clear paths of travel, to where to go to dump your trays and exit the lunchroom, and everything will be trained. So kids can learn pretty quickly and easily the procedures. And
They are. They're
we'll
better
have
at it.
procedures for all those. So
They're better at it than us
than adults are. Yeah, that's for sure.
Mr. Bertosh, let's move outside the school building for a minute to the school bus. On the buses, what information would parents need to know about how that's going to work, and maybe the cleaning procedures on buses and so forth?
Well, busing's going to be, a challenge, because trying to do social distancing on a bus will be difficult. So some things that will really be beneficial and helpful there, we will need the students to wear a mask on a bus. We would ask that students from the same family sit in the same area, so that if we come to a situation where we needed to do trace contact, it would be a lot easier. I know our bus drivers have talked about having places where they know the students sit each day, so they know who's around them. So if we did need to trace contact, we could be able to point that out very easily. We also recognize that there are plenty of students and parents who are concerned because they have kids with health problems and health concerns. And they're worried, can my kid ride the bus if my kid has asthma and can't wear a face mask? And we have that taken care of. We'll have a place on the first, in the bus where that student could sit. It could still be somewhat isolated from the other students as far as, they're not going to be 6 feet apart, but they're the only ones that would be there without the face covering. And the other kids around them would have a face covering to help protect them. Our bus drivers will be disinfecting and sanitizing their buses daily. To make sure that all the high-touch areas are cleaned and wiped down. We're concerned about our bus drivers. And so we have them with personal protective equipment that we'll provide them with, face coverings, gloves, those types of things to help keep them safe. And you know, we all need to keep in mind that as the governor's mandates change and things change, that could change too in the future. This is a fluid situation we're in. We've noticed that from day to day. We put together a plan and then we come out with new information. And so we have to be prepared to be flexible and to adjust as things come along. But we will help provide transportation to your kids, and we'll do everything we can to keep them safe there.
Very good. We've, speaking about the students that have maybe asthma or other breathing problems, it's our hope that the shield might be of benefit to many of them as well. You know, if the mask isn't possible, maybe that clear plastic shield would be. And maybe not everyone, but hopefully that can be of benefit to those folks.
Absolutely, and that's where we'd ask, you know, coming back to the very first question, we would ask individuals who are concerned about their students with specific health concerns, please get with your principal and your building administrator. Let's put together a health plan for your students so that we can minimize risk for your students,
Not just
as well as
on the bus, but
for everybody,
everybody.
and help make things as safe as possible. So, you know, open communication with that building administrator is going to be very, very beneficial, especially with busing.
Very good. This COVID-19 changes quite often, in the different circumstances and where it's hotspot or not. And so what about the situation, maybe Mr. Guyman help us out here, what if things change, or what if we do have a person in our building, a student or a teacher, a person that has been tested and gets positive for COVID-19? Now what do we do?
So two things, you know, one, just following up on Mr. Bertosh's response. One thing that I've seen that our staff, our teachers have just been amazing at through all of this, and even before this, is adapting to meet the needs of students. And as the needs change, we adapt and change. And they're great professionals, and I've gained just a huge amount of respect for our teaching community. But we will communicate out to parents as changes need to be made and let you know, and as we need to adapt. What our understanding is, so let's say I, for example, have a fifth grader, and let's say she identifies as, is identified as positive with COVID-19. We'll be notified by the health department, and through contact tracing, we'll identify any high-risk individuals who were in close contact with that child, and let the parents know so they can be monitored. And if there's a group of students, you know, that obviously test positive, or any student that tests positive, they'll be quarantined, you know, until clearance is given, you know, from their healthcare provider that they're ready to come back to school and that things are safe. But yeah, we'll stay in close contact with parents and let parents know, and that's one of the reasons we're doing these things such as assigned seating and social distancing, and so that makes it easier to contact trace kids and limit the number of students that are exposed, you know, to any student or adult who does test positive, you know, so that we can keep school running as smoothly as possible. But then also, if that student does need to be quarantined, our teachers and district staff have gone above and beyond to prepare online curriculum for them. You know, this last spring, it was a miracle for them to throw together, our teachers, what they did in a matter of 48 hours to get ready to provide online instruction. A lot of work has been done over the summer to prepare a curriculum, to prepare resources for students, that if a student does have to be home for an extended period of time, you know, they shouldn't miss a beat. They'll still be supported through online means and online instruction, and still have contact with great teachers. And so we feel like we have a really great system in place to really support and help kids that do need to stay home or sick for a period of time, and help their parents. So
Very good. Well,
that should work hopefully pretty well for us.
I think we all will agree to that. Our teachers, we really appreciate the work, and they have been just great. If things change, they take care of whatever is needed, and we sure appreciate them. So, thank you very much there. Some have asked about when the temperature being taken, and how often You know, are we gonna check the temperature of every kid every day, or how that
Sure.
is going to work? Mr. Forsyth, would you speak to maybe that symptom monitoring, temperature checking
Sure,
protocol that we have?
Sure. So what we're going to do is we're going to ask parents, first of all, to be kind of our first line there and monitor their kids who aren't feeling well, and ask them to keep kids home who aren't feeling well, and maybe help us out a little bit there so we're not having quite so many kids. I know it's tempting to send your kids to school with just a sniffle or something, but we need to be extra cautious right now under these circumstances. So we're going to ask parents to monitor that first and not send their kids to school if they're not feeling well. I think Mr. Guyman touched on resources online, and if those classwork and that material is available online, I think the kids can still have access to the education they need and get that from home for a few days while they're not feeling well. But if a student does get to school, we're just going to ask our teachers to monitor symptoms. Every classroom will have a no-touch thermometer so that if there is a question, the teachers can take that temperature. But we're just going to monitor kids, and if someone's not feeling well, we're going to have a designated room in the school where we can send those kids who may be symptomatic or have not be feeling well until someone can come and pick them up and kind of keep them isolated there until parents can get them. But it's really going to be just an effort of everybody in the school, along with the parents and the kids, to let us know when they're not feeling well, or to be a little more sensitive to keeping their kids home or taking their kids home when they're not feeling well. But we'll monitor that, and I think we can help, keep sick kids home when they need to be home, and help out that way.
Very good. Well, this question, we've kind of touched on it just a little bit here and there, but maybe Mr. Guyman, with your background in working with students with special needs, anything else that you can think of that maybe a parent that has a student with special needs of some form or another, something they would need to know about our plan?
Number one is, if there's something that a parent is worried about as far as a special health care need or mental health need that's been impacted by this, to communicate. Let the principals know, like Mr. Bertosh said, so that we can work with that parent and putting a plan together. I think you mentioned specifically asthma and accommodations we can make with face shields and other things. I also had a parent ask this morning about anxiety. Her daughter gets really bad anxiety when she's wearing a mask. I said, yeah, just communicate with me, and we'll put together some accommodations and a healthcare plan that'll work for that child. And so it'll really be on an individual basis. We do ask that as much as possible, parents work with their healthcare provider, and if there's a specific condition or diagnosis that will help us in developing that plan. We love to work with our healthcare providers and get recommendations from them on what could work for that child, and we'll do the best we can to accommodate their needs. But yeah, just communicate with us and we'll work with you.
Very good.
Mr. Guyman, I think that's really important, the point you got out about them working with their healthcare provider, bringing those suggestions to that health plan meeting, so that when we sit down with our school nurse, the administrators, the teachers that are there, we have all the information we need specific to that student, and we can make a plan most adapted to that particular kid's needs.
Yeah, exactly.
Very good. Mr. Forsyth, when will school start and when will it end? Our schedule, how will that look?
I don't think people are going to notice a big difference in start and stop times each day. We're working with Mr. Ross and the transportation department right now to kind of schedule those bus routes and make sure that kids aren't arriving at school too early or waiting too long to get picked up. So I think each school will release their bell schedule and let parents know when school begins and when it ends each day. But I don't think parents are going to notice a big difference. Maybe a few minutes in passing times may affect the bell schedule a few minutes, or bus schedules may impact it a couple of minutes, but I don't think parents are going to notice a difference. Maybe 5 minutes here or there at the most, but I really don't see this affecting or impacting start and end times each day very much.
Let me add one thing, maybe more specifically to elementary schools with after school and getting kids home safely. For example, we have a lot of students, a majority of our students are picked up by their parents. And so we will ask parents to be a little patient with us, because we will have to, each school is probably going to have to change some of their procedures for getting kids picked up in order to spread them out and socially distance them. And so it may take a few extra minutes. If you have multiple kids to pick up from school, they might not be right together. The second grader might be here in this spot, and the fourth grader down in this spot. And so our parents have always been great to work with us, but it may take a little extra time to get those kids picked up and get them home safely.
Very good.
Good point.
Another aspect of our schools and our culture and athletics and extracurricular activities, Mr. Bertosh. First of all, will they happen? And second of all, if so, what will it look like that may be different than it has been in the past?
Well, like Mr. Guyman said, the short answer is yes, that will happen. And we have every intention for athletics to take place in extracurricular. We may need to have, let's say for a choir or something like that that has a higher respiratory droplet output, we may have to have some accommodations as far as how we set our students up in the choir room or in the choir practice, but we have every intention of moving forward. That's a very significant part in the students' academic experience in school. I can tell you that our coaches have been instructed, they monitor the students, but coming back to, like we mentioned earlier, if we can assist the parents' help in monitoring their students as well. A big challenge that we're going to have from the student-athlete end is to be honest enough with the coach to say, Coach, I'm not feeling well. I'm experiencing some symptoms, and that student athlete not feeling like, well, that coach is going to hold that against me for playing time. And we just want you to know that that's not the case. Our first and foremost priority is to keep you safe, keep all of the student athletes safe, keep our coaches safe. And so our coaches are going to work with you. And so if your student needs to stay home from school because they don't feel well, we want you to stay home from practice as well because you don't feel well. We would ask you to communicate with the coaches. That's going to be a big thing. Let that coach know, I have symptoms for COVID, coach, and I don't want to spread that, so I need to self-isolate, I need to quarantine. And then, if the coach has some things they want you to work on independent while you're home, please do so. But parents, we will need your help. Athletes, we're going to need your help. We're going to need your honesty. And be straight up with your coaches and communicate whether you are or whether you aren't feeling well. The other thing is, if we do have an athlete that tests positive, we're going to need to quarantine that athlete, and then we're going to need to closely monitor those that are right there with them. I don't see us shutting down a program for 1 or 2 cases. If we got in a situation where we have multiple cases, then we would have to consult with our health department and take counsel from them and probably have to follow their guidance. But we're going to do everything we can to keep your kids safe. The coaches are really good at cleaning and sanitizing their water equipment, and they're going to have to be extra vigilant of that this year. They're going to have to make sure they're on a regular schedule of sanitizing water bottles. Probably to help us with that even more, we'd ask the student athlete to make sure they bring their own water bottle, and rather than we have anything that's being shared community-wise. As things change and as other guidelines come out, we'll have to make the adjustments. But we most definitely want athletics to take place. We want these kids to have that experience. It's vital to what they're doing. It's an extension of the classroom. And anyone who's been involved in that or had kids involved in that knows the tremendous educational value for life experiences, life skills that come from extracurricular. And so, yes, we'll have those.
Very good. Well, folks, we hope that this has been helpful. Some questions and answers. Hopefully many of those things have been provided for you. I just might mention also, maybe you've got a sense of the caring that happened with all of our employees, from these gentlemen, but all of our staff. We care about our kids and your kids, and we want them safe, and we want them to learn. Our superintendent has a little phrase that he uses a lot whenever we have a decision. So the decision is upon us. We're collaborating on what to do, and he'll always say, ask a question, what's best for kids? And that really has caught on through our whole district, and it's really our mantra. We want to do what's best for kids. And our superintendent, our school board are committed to doing whatever is best for kids, and that's where we're at, what we want to accomplish and do this coming school year. And so hopefully this has been helpful. Thank you for joining us, and have a great summer.
Everything's gonna be